Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Today I will present our research. The title is Improving the Quality of a Reproductive Health Aware Generation Among Students of SMA Muhammadiyah Kasihan. Our team, I am Dr. Nur Hayati as a team leader, and the team members are Dr. Anda Yoni Astuti, Bapak Haryono, Najmi Hafizah Anantanur, and Dr. Astika Cahyarani. Introduction. Adolescents' limited understanding of reproductive health amidst critical physical and psychosocial changes during puberty increases their vulnerability to risky behavior. To address this, counseling with expert guidance needs to be conducted at SMA Muhammadiyah Kasihan to improve students' reproductive health literacy and encourage responsible decision-making. This study aimed to improve students' knowledge and awareness of reproductive health through structured, expert-led counseling at SMA Muhammadiyah Kasihan. The intervention focused on equipping adolescents with accurate information and fostering responsible attitudes toward reproductive health from an early age. The study targeted 2 students of SMA Muhammadiyah Kasihan with a scope that included improving reproductive health literacy through educational counseling, which addresses cognitive understanding and effective awareness, and was designed as a school-based intervention facilitated by experts that could be adapted to similar educational environment. Methodology. The study employed a participatory community-based approach with a quasi-experimental one-group pre-test and post-test design. The intervention involved expert-led educational counseling sessions delivered directly to students, allowing for measurement of knowledge improvement and behavioral awareness through comparative evaluation before and after the program. Data were conducted using structured instruments, including pre-test and post-test questionnaires, to assess changes in student knowledge, as well as satisfaction surveys and participant testimonials to capture qualitative feedback on the counseling session. The data were analyzed by comparing average pre-test and post-test scores to evaluate knowledge improvement. Results showed that increase from 45% to 55%, indicating a 10% gain. This moderate yet meaningful rise demonstrated the effectiveness of the counseling intervention in enhancing students' reproductive health literacy. The finding, the counseling session resulted in a 10% increase in students' reproductive health knowledge, with average scores rising from 45% pre-test to 55% post-test. Participants showed a high engagement during discussion, and testimonials indicated improved awareness and more responsible attitudes. This finding confirmed that school-based expert-led counseling is an effective approach to strengthening reproductive health literacy among adolescents. The intervention fostered high participant engagement, with students actively contributing during discussion and reflecting critically on the material. Testimonials revealed not only increased awareness, but also a sense of personal responsibility and behavior intention. One student remarked, "I've gained a deeper understanding of how to protect my productive health from an early age." These effective outcomes underscores in the intervention success in promoting lasting, internalized learning beyond cognitive measures. Conclusion, the implementation of expert-led educational counseling successfully improved students' reproductive health knowledge and awareness at SMA Muhammadiyah Kasihan. The program achieved a 10% increase in student knowledge, demonstrated by pre-test and post-test results. High student engagement, positive testimonials, and the development of responsible attitudes indicate that school-based reproductive health education is effective in fostering both cognitive understanding and personal responsibility. This intervention serves as a practical model for enhancing reproductive health literacy among adolescents. This is the program documentation. And thank you. Assalamualaikum warahmatullahi wabarakatuh.